Hi, I'm Dr. Evie. I'm here to talk about what happens during a breast biopsy. So, you've been told that you need a biopsy. First of all, just because you're having a biopsy doesn't mean that the lesion is a cancer. Number two, before I come into the room to do the intervention, you will be well informed. I can very comfortably say that over 90% of the biopsies that I do, the patients, when it's done, they're like, oh, that's it? I'm like, yeah, that's it. And they usually think, oh, I was expecting worse. I'll usually explain to you briefly when I meet you for the first time, the day of. My technologist will talk to you and explain in detail what's going to happen. I will reiterate what's going to happen when I walk into the room. I'll actually let you listen to the sound of the biopsy device. You will have an opportunity to ask me questions. You should always have an opportunity to ask whomever is doing your biopsy questions. It is absolutely your right. You should know what's going on, what's going to happen to you. Oftentimes, the technologist has already ultrasounded, if it's happening by ultrasound, and that's what I'm going to refer to for this video. They will position you in the way that we want you lying for the biopsy. I will come in, we have a chat, and I'm going to take a look, and there's going to be local anesthesia. It's usually with a very tiny needle. It feels like a mosquito bite. A lot of people don't even feel that, quite frankly. And then local anesthesia goes in. Unfortunately though, for some people, this is the most painful part of the procedure, regardless of how slowly I put the anesthesia, just because of the pH of the pH balance of the freezing. And we breathe our way through it, through talking and through the music. And once you're nicely frozen, then I do the biopsy. It's a small needle, you'll hear the sound. And I find usually once one is done, people are usually kind of, okay, they're more at ease. How many samples do I normally take? If it's something that I suspect is probably benign, like a BI-RADS 3, I'll usually take at least 3 14 gauge core samples. 14 gauge is the size of the needle. If it's something that's malignant, I will take at least 4. And I have always found that this is totally satisfactory. Once the biopsy is done, we compress in case there's any bleeding. Lots of times there isn't, but we just do it just as a precautionary measure. The sample is put in formalin. I write on the pathology sheet. We send it to the lab. The collection is done later on in the day. And I always say you should get your results within 5 days to a week, roughly, right? I should have probably said at the beginning that you will be consented for this procedure, which is pretty important actually, because we can never force you to do a biopsy. It's a written consent. You read it, you'll make sure that you understand everything that's going on, and you'll sign it, and then we go ahead and do it. Key thing, we really guide you and walk you through this. I will tell you that at CWIC, the techs that I do biopsies with, they are fabulous. Fabulous, fabulous. They explain everything. They hold your hand. They'll guide you through the process. You have nothing to worry about. And yes, I do know that there's always that fear of not knowing what the pathology result is. This is real. And we do our best to get it out there as soon as possible. And we really do hope for the best. So if you have any questions or any more questions about what a biopsy is like, please DM me, write me a question, send me a question, and I'm happy to answer more questions for you.